The term normal grief, sometimes referred to as uncomplicated grief, encompasses a broad range of feelings and behaviors that are common after a loss. There are similar patterns that are pathognomic characteristics of normal or acute grief. These include somatic or bodily distress of some type, preoccupation with the image of the deceased, guilt relating to the deceased or circumstances of the death, hostile reactions, and the inability to function as one had before the loss. The feelings of normal grief include sadness, which is the most common feeling, anger, which is at the root of many problems in the grieving process. If the anger is not adequately acknowledged, it can lead to complicated bereavement. This anger comes from two sources: from a sense of frustration that there was nothing one could do to prevent the death, and from a kind of regressive experience that occurs after the loss of someone close. In the loss of any important person, there is a tendency to regress, to feel helpless, to feel unable to exist without the person, and then to experience the anger that goes along with these feelings of anxiety. Another common feeling is guilt and self-approach. Most often the guilt is irrational and will mitigate through reality testing. And then there's anxiety. Anxiety comes primarily from two sources. First, the survivor's fear they will not be able to take care of themselves on their own. And second, anxiety relates to a heightened sense of personal death awareness, the awareness of one's own mortality, heightened by the death of a loved one. And then there's loneliness, fatigue, helplessness, shock, yearning. When yearning diminishes, it may be a sign that mourning is coming to an end. Then there's emancipation, relief. Relief is felt particularly if the loved one suffered a lengthy or particularly painful illness. And then there's numbness, feelings that exist for abnormally long periods of time and at excessive intensity may portend a complicated grief reaction. There are also physical sensations that are commonly reported or experienced by people who are grieving. These include hollowness in the stomach, tightness in the chest, tightness in the throat, oversensitivity to noise, a sense of depersonalization, breathlessness, feeling short of breath, weakness in the muscles, lack of energy, and dry mouth. The following behaviors are commonly reported after a loss and usually correct themselves over time. These are sleep disturbances. After about 6 weeks, sleep disturbances begin to correct themselves. If a sleep disorder persists, it may indicate a more serious depressive disorder. And then there's appetite disturbances, which undereating is the more frequently described behavior. Absent-minded behavior is another one. Social withdrawal. This includes a loss of interest in the outside world. Dreams of the deceased, avoiding reminders of the deceased. Some people will avoid places or things that trigger painful feelings of grief. They might avoid the place where the deceased died, the cemetery, or they might avoid objects that remind them of their lost loved one. And then there's searching and calling out, sighing. Sighing is a close correlate of the physical sensation of breathlessness. Oxygen and carbon dioxide levels are similar to those found in depressed patients. And then restless overactivity, crying. Tears may have potential healing value. Stress causes chemical imbalance in the body, and some researchers believe that tears remove toxic substances and help reestablish homeostasis. Visiting places or carrying objects that remind the survivor of the deceased is another one. Often underlying this behavior is the fear of losing memories of the deceased. There's a difference between grief and depression. In grief, the world looks poor and empty, while in depression, the person feels poor and empty. The intensity of grief is determined by the intensity of love and the security of attachment. If the survivor needed the lost person for his or her own sense of self-esteem, for example, feeling okay about themselves, this will portend a more difficult grief reaction. Survivors of suicidal deaths have unique and very difficult times handling their grief. The degree of perceived emotion and social support from others, both inside and outside the family, is significant in the bereavement process. Those who do less well with bereavement have inadequate or conflicted social support. Those are all normal feelings and behaviors of uncomplicated grief. In my next video, I will discuss complicated grief, so make sure to follow and catch that video.